Hello, my name is Natasha Beckett and I am one of the clinical specialist respiratory physiotherapists on the pulmonary rehabilitation team here at Respiricare. This is a short educational video which is intended to supplement your pulmonary rehabilitation program or your home exercise program that will have been set by one of our other team members. This educational video will last for about 10 to 15 minutes and will focus on medication. We will initially start by talking about inhalers and medication that's available via inhalers, and we will then go on to talk about nebulisers and mucolytics. Inhaler therapy is most commonly used to treat patients who have either asthma or COPD. So if you have asthma or COPD, or perhaps a combination of the two, then the first part of this talk will be very useful for you. However, if you have a condition such as bronchiectasis or interstitial lung disease, then these conditions are not usually treated with inhalers, so you may not find the first part of this educational talk quite as relevant to you, but still well worth watching in case you pick up anything useful along the way. There are many inhalers, and broadly speaking they can be broken down into two different types. Firstly, we have our bronchodilators. So bronchodilators, what they do is they help to relax the smooth muscle around the outside of our air tubes. So by relaxing this muscle, it helps to open up the air tubes so there's more space for air to move in and out of the lungs, and this can make it easier for you to breathe. It can reduce your breathlessness, and it can also help to reduce symptoms such as cough. The other type of medication that's commonly given via an inhaler is an inhaled corticosteroid. Now, what the steroids can do is they can help to reduce inflammation and reduce swelling in the airways. And again, what this can do is help to open up those air tubes to make it easier for you to breathe. It enables more air to move in and out of the lungs and helps to reduce those symptoms such as cough and wheeze. Patients will have a different combination of inhalers depending on what lung condition that they have, the severity of that lung condition, and the different types of symptoms that they may well be experiencing as a result of their lung condition. So not everybody with asthma or COPD has the same combination of inhalers, so you may have something different to your neighbour. The most common type of inhaler is a short-acting bronchodilator. Now what this means is that the medication will help to open up the airways by relaxing the muscle around the outside of the air tubes, but as the name suggests, it only works for a short period of time. So these medications tend to work quite quickly, so once you've taken them they tend to start working within 1 to 2 minutes, but they only have their effect for up to 4 to 6 hours, and that depends on the type of medication that you've been given. The most common type of short-acting bronchodilator is salbutamol. You may well know this as Ventolin or as Salamol, and it usually comes in a blue device. Now, if you continue to get symptoms despite using a short-acting bronchodilator, then you may well be stepped up to a long-acting bronchodilator. Now, as the name suggests with this one, that the medication has its effect for a much longer period of time within the airways. We can get long-acting bronchodilators that last for 12 hours, and examples of this would include things like formoterol and salmeterol. We can also get long-acting bronchodilators that last for up to 24 hours, and examples of this would include things like Sebree, Brautus, Spiriva and Incruse. This would mean that you only need to take the medication once a day. There are two different types of bronchodilators working in two different ways. Now, the way in which one of these bronchodilators work is to relax the smooth muscle, which is around the outside of the air tubes. Now, by relaxing this muscle, it means that we can get more air in and out of the lungs and help to control your symptoms. The way that the other bronchodilator works is to prevent the airways from closing in the first place, almost like placing up a scaffolding in the airways to stop them from closing. So hopefully meaning that you don't get the symptoms in the first place. In more recent years, they have developed new inhalers which combine both of these bronchodilators into the same device. So it is now possible to use these dual-acting bronchodilators for our patients. Examples of these dual-acting bronchodilators would include things like Duraclear and Anoro, Spiolto. The other type of medication which is commonly given via an inhaler is an inhaled corticosteroid. The dose of steroid which is given in an inhaler is much lower dose than that which is given to you when you feel unwell and you need to take a steroid tablet. However, if you are on high doses of inhaled steroids for a long period of time, you may well need to have some additional medication to help protect your bones from the side effects of these inhaled steroids. Inhaled steroids are used in COPD only for patients who have a history of regular chest infections. So if you have had 2 or more chest infections in the last year, if you have had a chest infection which is severe enough that has meant you've had to go into hospital to be treated for that, or if you also have asthma as well as having COPD, then you would be a candidate for potentially trialling a steroid-based inhaler. If you don't have any of those things, if you've never had a chest infection, or you don't have frequent infections, you've never been into hospital for an infection, or if you don't have a background of asthma, then it's likely that you won't be offered a steroid-based inhaler. Inhaled steroids can be given on their own in an inhaler, which is usually the case in asthma, and these are often given in inhalers that are brown in colour. You may have come across Clenil or beclomethasone or Qvar in the past. In COPD, inhaled corticosteroids are usually given in combination with a long-acting bronchodilator, and examples of this would include things like Symbicort, Seretide, Foster and Relvar. If you do use an inhaler that contains an inhaled corticosteroid, then it is good practice to rinse your mouth out after you've used your inhaler. And the reason for this is that if any of that medication gets stuck in the mouth, on the back of the tongue or in the throat, it can sometimes make you feel a bit dry and a bit sore, and it can also lead to oral thrush. So it's well worth using a mouthwash or to rinse your mouth out after you've used your inhaler to reduce any risk of this happening. The newest combination inhalers which have become available more recently are what we call triple therapy inhalers, and these inhalers combine all of the medications together. So they include both types of bronchodilator and the inhaled corticosteroid. These are only used in patients who have COPD, they are not used for patients who have asthma. Examples of these triple therapy inhalers are Trimbo and Trelegy. Nebulisers are another way of delivering medication directly into the lungs, and they consist of a nebulizer compressor machine and a giving set, and that giving set usually contains either a mouthpiece or a face mask for the delivery of the medication. The medication for a nebulizer is prescribed by the GP and is given as fluid inside a small plastic vial. To use the nebulizer, you would open the plastic vial and pour the contents of the vial into the giving set. When you switch on the nebulizer compressor machine, it forces air through the giving set through a small tube and turns that liquid into a mist, which you can then inhale. Different medications can be given via a nebulizer, so we can also give bronchodilators via a nebulizer if they are needed. Our recommendation would always be to use the inhaler first. This is far more portable than using a nebulizer. However, some patients do find using a nebulizer when they feel poorly or if they have an infection can be of benefit to them, but we wouldn't recommend this on a regular day-to-day basis. It is also possible to provide saline or salty water solution via a nebuliser. And again, this is a medication which is prescribed by the GP, and it's usually only given to patients who have difficulty with mucus or phlegm on their chest. It can be a way of helping to encourage that mucus out of the airways and to improve the symptoms of cough and phlegm. The use of a saline nebuliser is often used in conjunction with other methods for clearing the chest, and we do have another video on chest clearance, so you may find that useful to you. It is also possible to provide some antibiotics via a nebuliser. However, this is quite uncommon. It's also only prescribed by your specialist respiratory consultant, who you would see in a specialist centre. Another medication that you may well be offered if you suffer with mucus on the chest that's troublesome and difficult for you to clear, that would be something called carbocysteine or mucodyne. This is a mucolytic medication, and it helps to bring the phlegm out of the chest, helps to make it easier for you to cough and clear that mucus. Carbocysteine is usually given as a 4-week trial to make sure that you respond well to the medication. If you do respond well, then it's very often added to a repeat prescription. If, however, you trial it for the 4 weeks and it makes no difference at all to your symptoms, then it would be taken off of the repeat prescription for you. The medication is given as a tablet form and is given between 2 and 4 times a day, depending on how it's prescribed by the GP. In this video, we have talked about medications which are available via a nebuliser and via inhalers, and we've also talked about carbocysteine or mucolytics as well. I hope you found this information useful. We do have other videos that you can watch as well, and again, I hope that you find these useful too. Many thanks for your time. This is Natasha Beckett. Take care.